Hello, I'm Jaime Wesolowski, and I'm the CEO of Methodist Healthcare Ministries. And it's a pleasure to be joined today by Katie Bollbach. Katie is the Executive Director with Partners in Health, and she is responsible for the entire United States. So thank you so much for joining me today. And if you don't mind, I'm just going to ask you a few questions. I'll let you answer first, and then I'll kind of tell you how it looks in our world at Methodist Healthcare Ministries. So first, I know both of our organizations are committed to health equity, and you look at it from a different geography because you're worldwide, really, and different cultures than we do. But please tell us why it's so important to focus on health equity for you.
Yeah, well, thanks for having me. And, as you mentioned, Partners in Health works around the world in 11 countries. We were founded in Haiti, and we have our roots also in traditions of liberation theology. And so our mission statement at PIH is making a preferential option for the poor in health. And to us, that's a way of saying, that the poor or those who have been historically marginalized deserve not just equal access, but deserve more and better care and service. And that we can't just look at health systems and say, as long as anyone can walk in the door, we've done our job, but rather what are the upstream drivers? What are the structural drivers of ill health? So we're talking a bit about yesterday, we know here in the US that only about 20% of health outcomes can actually be tied back to clinical care. The other 80% is the social and economic determinants of health. And so it's really essential if we want to improve health outcomes, create healthier communities and families and patients, that we've got to go further upstream and work on those broader social drivers. So to us, that's essential. It's not, health equity is essential to health. It's not a nice to have.
Absolutely. Well, it's fascinating what you all have accomplished over the decades, quite honestly. And we're a little bit new to it at Methodist Healthcare Ministries, and we focus on Central and South Texas. And I would say our area, our service area, is some of the poorest areas of the United States, namely around the Rio Grande Valley, the border of Mexico. And so we had been working mostly on downstream efforts for 24 years. And when I came over to the ministries in 2018, I worked closely with the board and then with the executive team, and we all realized that even though we did great work taking care of the uninsured, health outcomes were not getting better. They were getting worse, and so we needed to do something else. And just like the 80-20 that you talked about, we said we have to continue doing the 20%. We need to do it better, keep improving, but we really need to focus on the 80% and really look at those social determinants of health. And the toughest thing for us was to prioritize because there's so many things we could do, right? And so really kind of looking at all the possibilities and then prioritizing which ones we'd like to try to focus on first and then evolve into the other social determinants of health. So that's a little bit about our story. So since you've had a long journey with Partners in Health, would you tell me just a few of the highlights of that journey and in your pursuit of health equity?
Sure. Well, we started our work in the Central Plateau of Haiti, really working to deliver care and broader social services to a community that had been displaced by a dam project. And so a sort of internally displaced community in that Central Plateau, which had been impoverished through a range of other historical and structural drivers. But from there, the work we did with HIV and tuberculosis, I think really taught us about this approach of accompaniment, which is our kind of core philosophical approach at PIH, which we've really learned from our community health workers who accompany patients on their journey to health and well-being. And I think that spirit, that philosophy has driven everything we've done since then. So we now, as I mentioned, work in 11 countries around the world. Community health workers continue to be the foundation of that work everywhere we are invited and work today. So that includes here in the U.S. So when COVID hit in 2020, we were working with our teams around the world to prepare accelerating production of oxygen and training on infection prevention and control and facilities, and found ourselves at the epicenter here in the United States, where I think we sometimes have the misperception that we have the strongest health system in the world. We have some of the most innovative, amazing healthcare and research and innovation here, but we don't have a very strong health system. And so I think that was very eye-opening to many, or just put a finer point on something that people had known for a very long time. And so I think for us, that was a moment to kind of lean in and go deeper in our work here in the United States to work on the underlying crisis of health inequity. We knew that COVID was really an acute on chronic crisis moment, and that COVID was tracking along the fault lines of society in so many ways in terms of impacting communities of color, low-income Americans, immigrants. And so that was when I came back to PIH. I've worked with Partners in Health in Rwanda, and I worked in Sierra Leone on the Ebola response and recovery, but was, felt called to come back and support doing some of that health equity and system strengthening work here at home. So I think it's been an exciting new chapter for us to think about how we can also bring some of the learnings from our extraordinary colleagues in Haiti and Rwanda and Sierra Leone back home to the United States. And I think we have so much to learn from those health systems. While they may have fewer resources than we do in aggregate here, they're often designed in a way that's better, more functional in terms of trying to reach and serve the poorest and the most historically marginalized. So I'm not doing justice to our 40-year history, but that's a quick snapshot of my kind of journey with PIH.
I thought it was a great description. And, my conversations with you and John earlier, I think your story around community health workers is probably the most amazing one I have heard. So I want to learn more from you. We're ready to go to Rwanda to learn. And for us, I think our highlight, I guess, for us started with a celebration and then a disappointment, and then we did something about it. And that was when we went to the legislature in Texas in 2019. We realized that so many areas of the colonias, the unincorporated areas around the border, had no clean water. And so they had to go get water pumped and bring it to their homes just to flush their toilets and to cook with and things like that. So in the 2019 legislature, we got over $100 million approved to dig wells to give those people fresh water. And then shortly after that, a friend of mine from Texas A&M University School of Public Health came to me and he said, Jaime, it's great that Methodist Healthcare Ministries did that. Unfortunately, the water in most of the colonias is laced with arsenic and lead and other terrible chemicals. It's making their children and their families sick. Mm. And of course, I went from this high to this very low. And so we started working together on what do we do about it? And we funded a 2-year study that Texas A&M is doing. That study is going to be completed at the end of this month in June, so we're really close now. And in the meantime, I asked them, so while we're studying and we're taking urine samples and blood draws of the people and things like that, what can we do to help them use the water in the healthiest way possible? So they have also helped us educate the population in the colonias to do just that and to use the water that they have in the best way. So even though this part isn't over yet, I believe I'm very bullish on the fact that it's going to be very successful. So we're looking forward to going back to the legislature with some facts and figures that are going to be hard to argue with. I'm talking to other international foundations like the Ford Foundation who are very interested in our study to possibly fund some help for the colonias. So that's kind of one of the highlights, I'd say, for us. And then one more question. In your phenomenal journey, just like us, I think we have had this conversation where partnerships are so important. Neither one of us can do it alone. In fact, partners is even in your name, so that's pretty impressive. But tell me a little bit about why you think other organizations should consider going into health equity, and then how would you recommend they get started?
Yeah, great questions. Well, our founder, Paul Farmer, once said, it's, with rare exceptions, the most important things and the biggest accomplishments you'll have in life, you'll do with others in a word, partnership. And so I'm probably butchering that quote a little bit, but yeah, I think in this work, you can't do it alone as an individual, as an organization. It's got to be a deeply collaborative effort. We know because of the nature of our health system here in the US in particular that's so fragmented, and the nature of social determinants of health that we were talking about, there's no one institution or one sector that can solve those challenges. We need the healthcare system, we need community organizations and leaders, we need philanthropy, the private sector, the public sector on so many levels, federal, state, local. So yeah, I think to solve these most acute and long-term chronic challenges we face in our health system, we need everybody at the table. I think COVID showed us that, even more sharply, that to really address stopping transmission, getting the vaccine rolled out, it was absolutely essential that we had all of those folks around the table collaborating, building relationship, working together. And I think it also helped illuminate for a lot of folks here who might think of themselves as housing advocates or food bank, food security service providers, or barber shops, whatever it is, that they had a role to play in advancing public health and community health, that they often were doing public health and community health work, even if they called it other things, or we're already doing critical work to advance health equity. So I hope we can build on those learnings. I think if there's any bright spots from this incredibly challenging period over the last few years, it is that we've expanded the movement for health equity and public health in a different way. And I'm really excited to continue to build on some of that momentum. We've been able to meet amazing new partners in recent years as well, and I think continuing to link arms and do this work together is going to be essential, because it's, as you said, it's long-term work. There's no one and done in this work. It's we're trying to undo generations of harm and neglect in a lot of cases, and so I think we got to be in it for the long haul together.
Absolutely. What is the one big idea that you're pursuing at Partners in Health in pursuit of health equity?
Yeah, well, our big focus in the U.S. right now is on advancing community health workers in this country. We have amazing history of community health workers around the country over the last 60 plus years, but often in small pockets, doing amazing work in communities, with health centers, with community organizations. But we're seeing, coming out of this COVID crisis, some renewed momentum in this extraordinary workforce. For those who don't know, I know you're familiar, but community health workers are trusted members of a community who can be advocates and health educators and care navigators, organizers. They do all kinds of incredible work, but they can really serve as an essential bridge between patients or communities and health services and social services and policymakers. And so we just think community health workers are the missing foundation in a lot of ways here in the United States of a more community-centered and equity-centered health system. It's really been the focus of our work around the world for the last 40 years, is investing in and elevating community health worker leadership. So we're working with CHWs all over the country now to support their professional recognition and advancement, their leadership in their communities, but also working in DC on trying to advance investment in CHWs through Medicare and Medicaid, through grant programs. So that's kind of it's not a new idea, it's a very old idea, but one that we think is overdue to be elevated in the United States as a critical workforce and incredible set of leaders and communities that can really unlock an accelerated path to health equity.
Fantastic. Yeah, I guess our bigger idea is brand new for us, and we had a board advance for our board members and executive team, and we asked them to come up with a big idea of something we're not doing yet, or we're not doing enough of. And after 2 days of working on that, the big idea ended up being to take 3 large geographies along the Rio Grande Valley, again, some of the poorest areas in the United States, and to decrease families in poverty by 2 percentage points within 10 years. So that's a daunting goal. So you have to be careful what you ask your board for sometimes. They are passionate, and they gave us a great goal and a great idea. So obviously that's going to be multifaceted. Our team is just starting on determining all the priorities that we're going to focus on to be able to accomplish that. But we think we'll do it, and that'll be 10 years from now. That'll be really something that will be incredible to take this area of the United States and change the trajectory of their poverty. So Katie, what words of advice would you give organizations that are thinking about starting this journey for health equity, and what would you do to encourage them and maybe give them some advice on how to get started?
I guess I'd say first, connect with leaders in your community, organizations in your community who have been doing this work. We have some extraordinary leaders all over the country. In any community around the United States, you could find folks who have been at this for a long time. So I'd say go, listen, learn, understand, the data and the specific dimensions of health inequity in your community today, and really see where you can fit in and support that ecosystem of partners, because we need everybody in this fight. We need everyone at the table, but figuring out kind of how to be additive and supportive of existing frontline community leaders, I'd say would be my first piece of advice is really seeing, we use this word accompaniment at PIH a lot, so identifying visionary local leaders and organizations who you can come behind, accompany, support, and then figure out where you can be additive from there.
Yeah, I can't agree more. I think it would be great for organizations that are thinking about that to visit other organizations like Partners in Health, or even those of us that are fairly new into this journey, and to look for inspiration, and then really educate the workforce. That was something that was really important for us, to truly educate the workforce. And then once you step into it, I would say look for partners. I think that's very, very key, and we're fortunate. We started that very early in this journey, and just in the first several months, it was clear that there's only so much we can do. We're blessed with resources, but we really need good partnerships to really have the biggest impact we possibly can. Well, thank you for that, and I rejoice our partnership, and look forward to making it even tighter going forward. And for us, I think it's very clear. I came from a healthcare background. I spent decades as a CEO of hospitals and hospital systems, and this is so refreshing to be able to do more than healthcare, because healthcare is not health, as you know all too well. Healthcare is treating individuals when they're sick. I love this work where we can actually go out in communities and work on social determinants of health gaps with communities, not just individuals, and truly go upstream. It's very, very rewarding. And again, thank you so much for partnering with us, and look forward to the future of our partnering. And hopefully we can get a lot of other organizations started. For us, the beginning of transforming our organization into health equity was a daunting but very impactful part of the journey, getting people to understand where we can go and how we can make a difference. So I really like them to lean in to this and do the best they can. So I want to thank you for joining Katie and I today, and hopefully that some of the comments we made inspires you out there. So again, thank you for joining us.